Hey everybody, Dr. Rob here. Facebook Live Monday. How you doing? I hope you had a great weekend. My weekend was excellent. Had some interesting feedback from last week. Always looking at bringing you cutting edge stuff. So do me a favor as we start this. Please like, comment, feel free. I'm going to answer questions at the end. This one's going to be about 20 minutes. And share it. You guys did a great job last week of sharing all the information. 8 out of 10 Americans have lower back pain, and about 35% of Americans suffer from neck pain. So I thought, what better than to talk about neck and lower back pain, and what better than to talk about how do you assess it, how do you treat it. I just want to put this out there. If anybody has any questions, feel free to reach out to me, DM me here. Not questions on what I'm talking about, but a personal question where you want to ask about a condition that you have. With so many people suffering from lower back pain and neck pain, especially now, we're not moving around, we're sitting more, we're using all these devices, laptops, phones, and the such. Many people are getting, postural faults and issues like that, lower back and neck pain. So one of the things I wanted to talk to you about and started off with on neck and lower back pain very simply is musculoskeletal conditions, musculoskeletal being muscles in the skeletal system combined, increase the risk of what we call chronic disease. Chronic disease is a disease that cannot be cured with a vaccine, really helped with a drug that you have for more than 3 months. So they did an analysis of over 2 million people, which showed osteoarthritis increased the incidence of cardiovascular disease. So our osteoarthritis, interestingly enough, for me, OA, that's what we call it, is the body's response to inflammation. It is not wear and tear. So many people say it's wear and tear, I got old, it rubbed, but it's the rubbing that causes the inflammation that poses an issue. So prevention and early treatment of musculoskeletal injuries, something like osteoarthritis, back and neck pain, may play a major role in preventing other chronic disease. And it's really simple. The reason that we say that is osteoarthritis and musculoskeletal injuries elevate your inflammatory markers. And by elevating your inflammatory markers, you have inflammatory markers throughout your body. You're going to get systemic inflammation, leading you down a path of chronic disease. So real good study that came out on July 3rd on 2020 spoke to the idea of systemic inflammatory markers in neck pain. It had a systematic review. 10 studies, it was a meta-analysis. 10 studies were included. There were 706 participants. 3 studies were with acute whiplash associated disorder. We all know whiplash. I should probably say whiplash, where your head goes back and forth. Very common in whiplash in a motor vehicle accident. Whiplash also occurs in concussion injuries. 2 studies were for chronic whiplash-associated disease, and 4 were for non-traumatic neck pain. When they say non-traumatic, they're not talking about a concussion. And 1 was for chronic mixed whiplash and non-traumatic neck pain. The meta-analysis revealed, you guys ready for this, an increase in what we call interleukin-1 beta by 59%. Interleukin-1 beta is that interleukin that's been marked as a culprit in the cytokine storm. So just from having neck pain, you increase about 60% your markers of inflammation in interleukin and 45% in TNF alpha. So that's in chronic neck pain. So when you have these musculoskeletal injuries, so many of my patients like to say to me, hey, I wanted to see if it went away. The pain just went down a little bit, so it's good enough I can deal with it. That's putting a Band-Aid on a bullet wound. That is not getting to resolution. That is not allowing you to get to the part and point of where you're healthy. Pain is a marker of injury. It is not the whole thing that we go by. And I understand it. If it hurts, you tend to it. If it doesn't hurt, it's a symptom that something's wrong in the system, inflammatory system. So the conclusions very simply were the findings in this article implied the raised blood inflammatory markers presented in chronic neck pain, which may represent going inflammatory processes in these populations. So you're really looking, when people have these chronic issues, that they have got what I'd like to refer to as inflammation. So let's look at some of the lower back issues, pro-inflammatory markers and lower back pain. There was a positive association with what we call C-reactive protein and interleukin-6. C-reactive protein is tissue inflammation, and interleukin-6 is the interleukin that's seen in cytokine storm. It was really shown to be high and elevated in non-specific lower back pain. Interleukin-1 beta, which we talked about before, was also shown to be very elevated within those people that had disc degeneration in your lower back, in your lumbar spine. About 3 or 4 years ago, there was an interesting article right out of New York that spoke to the idea of a new approach to diagnosing lower back pain. So where the findings really determined that levels of interleukin-6 was significantly higher in subjects with lower back pain compared with the controlled participants. So therefore, participants that had lower back or something like spinal stenosis or degenerative disc disease really had higher levels of these inflammatory markers than those who didn't have any back pain or any back injury. So we're making a case here for people to realize that there are interesting assessments, and one of the biggest assessments that I try and teach when I lecture to other docs and I try and share with my patients is that let's look at the body from the inside out. Let's take a look at blood markers. Let's take a look and try and be more evocative, if you can, by looking the inside and seeing if there's inflammation going on. And if there is, there's a direct correlation with these inflammatory markers and chronic lower back pain, disc degeneration, neck pain, and the such. So if somebody would have come in and I would tell them that their markers were high for, let's just say, interleukin-6 and interleukin-1 beta, and they would have a propensity towards lower back pain, it's something that they should consider and something that they should seriously look at. That's what the doctors should be doing. That's what the primary care, that's what the doctors of chiropractic should be looking at. We should be looking at specific blood markers. Those blood markers leading us on a path to see if that patient's on fire. So what do I do? In no specific order, after I assess, and obviously I'm going to do a physical assessment, and one of the biggest things in the physical assessment is I'm going to put you through ortho and neural testing. Not only that I'm going to do ortho and neural testing, I'm really going to take a good look at movement. And we're going to go through movement in a few minutes, but the idea of movement is a critical element. I'm also going to talk about exercise. Obviously, I'm a chiro. I'm big on reporting on adjustment. I do some flexion distraction, but I wanted to start with what nutritional supplementation I would recommend. So I've got some interesting studies. One that came out in December of 2009 on fish oils. So they talked about 4 to 6 grams of EPA and DHA fish oils really showed to decrease inflammatory markers by 50%. So adding fish oils into your everyday usage if you have lower back pain has a protective effect on decreasing the incidence of progression of spinal disc degeneration. So having said that, clearly omega-3 fatty acids is a great choice. It's a great choice for a multitude of things, but it's a great choice pointed at lower back pain. Vitamin D, what they found is that people who are deficient, and most people are deficient in vitamin D. Vitamin D deficiency is found on a blood test, very simply. You want to be more than 30, but you really want to be more than 50 or 60. So what most of my suggestions revolve around is about 5,000 IUs of D3, always with K2. A good friend of mine was telling me, yeah, Rob, I'm taking D3, it's real important, etc., etc. And I agreed with him. The only problem is if you don't take K2, your calcium can cause plaquing. So D3 with K2. K2 to K1 in about a 10-to-1 ratio. So D3 on its own just is not that healthy anymore. In fact, D3 on its own in any kind of volume may be very detrimental to one's overall health. And here's a surprise for the spine: glucosamine and chondroitin. Now, most people take glucosamine and chondroitin for their knees, and there were good studies on their knees, but glucosamine and chondroitin have really shown to be very disc filling. So the discs are in the lumbar spine. There is a good portion of them are made of water. They're actually only about 20% jelly and about 80% water. So what you want to do is glucosamine, HCl, and chondroitin sulfate are great choices. They're great choices to take together. This is a study from 2003 that I usually cite with my patients that really speak to the idea of rehydrating the disc if you took them in combination. More so than that, that was shown on an MRI, and we all know MRIs are very objective. So now we're looking at omega-3 fatty acids, vitamin D3 with K2, and glucosamine. Glucosamine and chondroitin are well-researched nutrients. They help form the shock-absorbing components of cartilage and heal articular surfaces. Glucosamine, HCl, and chondroitin sulfate are shown to reduce pain and inflammation and to slow cartilage loss. Some of the other things I would recommend in addition, if it was a disc injury in the lumbar spine or the neck, would be hyaluronic acid. Hyaluronic acid is interesting in that hyaluronic acid really shown to allow for a slipperier surface between the bones, in between the discs. And unfortunately, as we age, hyaluronic acid decreases. Another herb or nutrient that I like a lot is turmeric. Everybody talks about turmeric. The active ingredient is curcumin. Turmeric is shown to inhibit inflammatory markers, inflammatory pathways. It's much more potent than an NSAID without any side effects. It actually also stimulates tissue repair and especially regeneration of muscle tissue, which is typically implicated in neck and lower back pain, and it blocks the or inhibits NF-kappa B. NF-kappa B is the signal transducer of inflammation. You may want to mix it with some herbs like ginger, which is anti-inflammatory and antioxidant, and boswellia, which is also an anti-inflammatory herb. Core training, bracing. So many people do sit-ups. Sit-ups are without question a no bueno. They're not a good choice. Sit-ups are a really bad choice for lower back pain because what they do is they enable you to bend at the lumbar spine, at your lower back. So if this is you and you're bending like this, your lumbar spine is pulling on the disc, it's pulling on the collagen, and it's ripping that collagen. So what you want to do is you want to avoid sit-ups. You want to do what they call bracing, a 360-degree co-contraction around your abdomen region. You want to get all the muscles to work like one big corset. This kind of follows what Stuart McGill says. Stuart McGill is maybe the forerunner in core exercise. Having mentioned that, the exercises that we recommend here for back rehabilitation would be a front plank, a properly done side plank, a bird dog. What happens is physical activity actually attenuates fibric alterations to a key muscle, your key extensor muscle in your lower back, and that muscle is called the multifidi. By able to do that, not allowing that multifidi muscle to get fibric, you actually hold off intervertebral disc degeneration. Some of the other treatments that I like a lot are low-level laser. Everybody knows I love my Arconia FX 635 and now my Arconia FX 405. So what they found out, the lasers send a photon in the area to allow for electromagnetic transfer of energy. Healing is quick. There's no heat. 8 visits and we're seeing breathtaking changes. It's revolutionized my approach to treating lower back pain. Now that we said that, when you look at the double-blind tests, 50% decrease in pain in 8 visits without any other chiropractic treatment. So when I couple the chiropractic treatments, adjustments, soft tissue, exercise, and nutrition, we're in a month getting great outcomes. Now, last, one of the things that I don't talk about that much is sort of a flexion distraction, decompression idea. So it's kind of opening up the lower back. When you do that, outcomes are good. You don't get nutrition in your lumbar discs. You do it through what they call imbibition for the pumping of the disc material. So this not only allows for what we call a negative like a vacuum and allows some of the disc material to get sucked back in. It also provides imbibition for getting nutrients in your lower back pain. So I'm just going to see if we had any questions and comments. Well, it's been quiet today. We've got the one question and comment that they take vitamin D3 with K2. I know a lot of people are away. A lot of people now are also working. So if you have any questions, feel free to put them. Share the material. We're going to be on tomorrow at a special time, 12 o'clock. We got a great guest. You're going to love it. I hope to see you tomorrow. Dr. Rob, always yours in health.